I'm sure that there are many, many comments and questions, but I'm going to ask you to hold fire for a while. We are, as Paul said, ahead of schedule, so we're not due to break for morning tea until 11:15. So I'm going to ask my colleague and friend Andrew Phillips, because Andrew has got some sort of high-level or strategic comments to make, which I think will inform the question and discussion which we will no doubt have. So can I introduce you? Andrew Phillips works for the National Rural Health Alliance when he's not building his domestic cathedral inland from Nowra, which he's working very hard on. And the National Rural Health Alliance owes much credit to Andrew for the work that he has done and continues to do for the Alliance over many years. Thank you. Andrew.
Thanks, everyone. And thanks, Paul. It's always, I've sat in on a few of these, and I've always been very interesting and very hopeful for us. You probably get a sense, my background is in epidemiology and biostats and that sort of thing, so my interest is largely in, what does it look like out there, what's going on, and so quite a few of those comparisons between RA and Modified Monash towards the end, for me, are particularly interesting, and it's the sort of thing that we've, over the last quite a few years, we've been saying to the department and to the various ministers and whatever about the fact that town size is so important and that remoteness areas doesn't really pick it up particularly well. So for us, it's very exciting. It's very exciting indeed. Just a word on the little book of numbers that Gordon mentioned earlier. It's just bear in mind when you look at it, and I would recommend you look at it. It's potentially a very valuable resource for you. We spend a lot of time running around trying to get numbers from various places to add to submissions and whatever. And there's so much data around that it's... Sorry. There's so much data around that it's often difficult to find what you need when you need it. So this was our attempt in-house to put something together which we could use, and then we thought, well, it might be useful for other people. But bear in mind, there are lots of holes in it because I'm 2 days a week and then we've got lots of other things to do. So we're building it as we go, but what we've built is available for others to use. Anyway, just on to just some thoughts here. If you like morning tea, I'm a bit of a bridge between what does Modified Monash look like and what is currently being done with it and what could we do with it down the track, and that's what Martin and Louise and Sarah, etc., will be talking about after morning tea. So, what do I do here? Oh. We come from a position, I guess, in the Alliance. Our interest is in the health and well-being of people who live in rural, remote parts of Australia. It's not about doctors, it's not about nurses, it's not about allied health, it's not about services generally or hospitals. It's about the health and well-being of people in those areas. That's our focus. And we know that over the past 15 years or so, remoteness areas developed by the ABS has been an incredibly solid tool to split up Australia into a number of categories. Now, the ABS, because they own it and maintain it, this tool has remained up to date and relevant in all of that time. But the thing we're worried about, as I mentioned before, over quite some time, is the fact it doesn't define or doesn't deal with town size particularly well. So a place like Little Urannah, west of Wagga, is classified in the same way as Cairns or Townsville or Darwin. And they're very, very different places where access to a whole range of issues that relate to health are quite different. So, for example, in a small place, a small rural town, not only is your access to a doctor or specialist services or community health or whatever more difficult than if you lived in a larger place, but also children's access to education. It's more difficult to get to university because of the logistics and the money involved in getting to those places. The opportunities for work are less. The range of occupations is more constrained. So the impact on social determinants of health is quite substantial. So that's why we're particularly excited about Modified Monash, in that you've now got this ability to describe what's going on in rural areas, rural and regional areas, according to town size. As Homer would say, And so what sorts of things might you, if you're not already thinking about it, what sort of things might you be thinking about, might you hope will be discussed over the next hour or so? And to me, they come in two packages. There's the program administration side. So currently you've heard that the department is using Modified Monash to run a number of programs, and they're thinking or planning to roll it out to other programs. And some of those might directly affect you. But there are, of course, there may be other uses. There might be other government department or areas of government where this might also be useful. I know there are some people here from other areas who might find this interesting. So where will it all end? Will Modified Monash take over the world and be used for pretty much everything, or will it only be used in some small areas in terms of program administration? We don't know. We're just asking questions, but it's something you might want to think about. Secondly, with the statistical reporting, we would love to see everything reported by Modified Monash, possibly. Knowing what we know about it at the moment, we might be deluded, but I think it's pretty good. So, there may be some problems in doing that. And there are problems, is it technically possible? And from Martin and Louise and from David, we'll hear something about that sort of thing after morning tea. Is it financially possible? The cost of doing another set of analysis on top of remoteness areas, that may be prohibitive. Is it appropriate? Are there some things that's just not appropriate to report by Modified Monash? And what my guess is that down the track, you'll have a lot of stuff still reported by remoteness area, because it's very standard geography, it's very solid. And there might be certain areas where Modified Monash is used as the basis of analysis because of particular interests of those doing the analysis. My feeling is that, as Paul showed, that if you look at it by Modified Monash, you can get quite a different picture. So as time goes on, and as we become familiar with some of the analyses that could be done by Modified Monash, there may tend to be a move to do more analysis in a wider range of areas. So, and there may be other uses too. I'm not sure. I haven't thought of any. I did think, being a sort of a bit number-like and epidemiological, we always like a bit of, we like to know where we're starting from and the populations we're playing with. Now, I've only just got a couple of slides here, and that's it, and then it's time for morning tea. But like Paul, I thought it would be very useful to look at this, but possibly from a slightly different perspective. I'm vertical, whereas Paul is more horizontal. But apart from that, I'm probably looking at it more from a statistical and reporting perspective. Here's Modified Monash, and there's an array, and this is just a population split up. Okay. And what is fascinating is the fact that you've got all these people here. On the mic, Andrew. Sorry. All those people over there that I just indicated, they're previously they've been categorised as very big lumpy areas. So in outer regional area, you've got Townsville, Cairns, Darwin making up about a third of the population in that area, and then you've got all the little places like Urana and Wellington and a range of other places that have their own special needs because they're so small, lumped in outer regional. When we go to Modified Monash, we've got a much more interesting spread, but also we've got smaller groups to report by. So for administrative data like MBS data and mortality data and hospital data and so on, it's going to be quite reasonable to be able to report by Modified Monash. But for survey data, it may be slightly different. You might start running out of numbers to report with any degree of certainty about what's going on. So these are interesting areas and interesting things to think about and discuss over the next hour or two. I think that's probably about it. Gordon.
Is it